Short-term follow-up for these babies, like I said, is within 2 to 3 days after discharge. Hepatitis screens, many of these moms are positive for hepatitis, especially Hep C. Growth and nutrition monitoring, these babies have a tendency to overeat. And pediatricians can make the decision to perform developmental screens. And there's different screens out there that we have, and these babies are screened from their first pediatric visit. We also encourage referral to community services. So our transition nurse and our social service will make referrals for birth to 3, home visits, Easter seals, Head Start, etc. So these families are referred to these community services as well. And then long-term, because we don't know about their neurodevelopmental sequelae, many of these babies may have ADHD, and that's not detectable until they're like 4 to 5. They really need long-term follow-up, and that can't be overemphasized to these families. They really need to make an effort to prevent losing these patients to follow up and to keep them in the system. And one of the ways you can do that is by that unconditional positive regard, still while keeping the baby safe, but also supporting the mother. Now, a little bit ago, we talked about smoking and how it impacts neonatal abstinence syndrome, and this is just a little chart that tells you on the left is the amount of morphine that we have to give the baby. So you can see that a non-smoking mother, the baby receives or requires a lot less morphine than a mother who has a lot of smoking. So if a mother smokes cigarettes and is also addicted to opioids, her baby's length of treatment will definitely be longer. Here's the length of stay. The length of stay for a non-smoking neonatal abstinence syndrome baby is about 8 days, where it goes up to over 15 days for a mom who smokes. Now, we definitely need to do high-risk pregnancy referrals when these babies or when these moms are first diagnosed, even before the baby is born. Child Protective Services is not involved before the baby is born, but we do the SBIRT training in all of our OB offices, and we also have the on-site social worker and transition nurse. So they work really closely with our OB offices. All illicit drug-exposed infants are referred to social service, and social service, because we are mandated reporters, report that to the appropriate county CPS. I have seen, and we suffer from very inconsistent handling of these cases. We have some counties that are very proactive and actually will take custody or give custody to a family member until the mother is in some kind of treatment. We have other counties that will say we will see the mother at home and do a home plan. We also want to provide them with in-home services, and sometimes CPS will do that. And finally, foster care. Now, that rarely happens. In our 3 years, maybe only 2 or 3 babies have been removed from the family. So what kind of systems can we do for our community? Prevention seems to be the most reasonable approach. Really, we don't want to have a baby born addicted to drugs, but unfortunately we do. So we try to prevent them. We start them early, and we do education in our schools. We work with DARE and resource officers. We work with drug-free clubs. We work with local clinics and methadone treatment facilities. And if you've seen lately, there have been videotapes of neonatal abstinence syndrome babies featured in the news, and they are showing these to different news agencies and also different commercials. You've probably seen that recently on TV. Awareness is definitely increasing. Awareness of these problems really needs to be raised in the community. We partner with our pediatricians, our emergency departments, our OB/GYN providers, our treatment centers, and we have our poster campaign and pamphlets that we have developed. And we have a pamphlet that is specifically for pregnant women. We have a pamphlet, what to expect after your baby is born. And finally, we have a pamphlet all about feeding, and it addresses breastfeeding and formula feeding. So we talk about resources and programs for drugs and other substance addiction treatment through our transition nurse, and we also spread that information in the community as well, because we want these mothers to seek OB care. The last thing we want is for these moms to avoid her prenatal care because she's worried that her baby will be taken from her. So there's very few studies that show the effects and the long-term effects of neonatal abstinence syndrome on babies, but here is one. By 7th grade, 4 out of 10 neonatal absence syndrome children fail to meet state-mandated test scores. There's also another test out there that I read recently that children whose mother smoked marijuana during pregnancy have an IQ score of at least 10% less than their peers. So because this problem is so new and it's only a few years old and it's only been identified and treated for a few years, we're just now seeing these students start to become in school. So you're just now starting to see some of these studies. So we are under renovation. This is actually our old therapeutic room. And some of the special things we did for this room were decrease the lighting, we have white noise, we have soft colors, and we actually have privacy screens. We're actually going to all private rooms and rooming in, and we're real excited about that. We have these babies treated on a brand new floor, and we have a playroom for siblings. We have a room on the top right that kind of looks like a hotel room. It has a mom bed, a bassinet, a rocker, recliner, a desk, a TV, and its own private bathroom. So we find that taking care of these patients as a family, rather than just having the infant in the nursery, really decreases their length of stay. It decreases the amount of treatment that they need, and it really produces a much healthier outcome because as that mom is there taking care of her baby, we can see her family, we can see what kind of support she has, we can see that she's going to her doctor's appointments. So really, if taking care of the family is really the goal and is really will give you the best outcome if you treat it as a family-centered problem. So that is my lecture on neonatal abstinence syndrome. I'm happy to entertain any questions. I can give you all my email if you want to email anything specific. I'm happy to share pamphlets or any other information that you need. Just ask.